So hi, this is Mrs. Shepherd, and I'm going to just show you how to do some closed circuit suctioning on a patient with a tracheostomy. So a couple things here. This patient is on a ventilator. This is the ventilator circuit. Closed system suctioning. This suction tubing is set up to my suction device, and it's on continuous, and we're going to keep it between 120 millimeters of mercury. Now, this is not suctioning all the time because I have this locked. It's locked now, so it won't suction. So, before I suction a patient, I'm going to listen to lung sounds to assess what the lung sounds are. I'm looking specifically for bronchi, anything that's out of the ordinary. Before I suction the patient, I'm going to go to the ventilator and I'm going to give them 100% oxygen, hit enter, and this is going to give them 100% oxygen for 2 minutes before I suction them. During this time, they may be symptomatic, so they may be coughing. That's perfectly normal. Because this patient has a tracheostomy, there's a different length for the inline suctioning because there's a shorter length between the trach and the lungs. The trach and the lungs. When we have an endotracheal tube, the endotracheal tube inline suctioning is much larger. Oh, for God's sakes. Okay, can you? Oh, for goodness. Okay, so now it's been 2 minutes. The patient is hyperoxygenated. What I'm going to do is say, Mrs. Jones, it's here. Hi there, it's Mrs. Shepherd. And I'm just going to suction you a little bit, okay? I'm going to check the name and the date of birth when I'm doing this. I'm looking at the allergies, no known allergies. So what I'm going to do is I'm going to unlock this. There's a locking mechanism, and this inline suctioning is changed every 3 days. So now it's unlocked, and I can test it by going, just pushing down gently. You hear that? Now it's not actually suctioning the patient. All it's doing is sucking some of that oxygen from the ventilator. So I'm going to place some gloves on. Even though this is closed, you still want to put some gloves on. And I'm going to stabilize this, and I'm just going to put the suction catheter down, and then I'm going to depress the button as I pull it out. Then I'm going to let the patient breathe. Take some nice deep breaths. I should have some mucus flowing up through here. I'm going to take note of the type, the color, the consistency, and the amount. So it could be white, it could be yellow, it could be green. If I'm not getting a whole lot, but I'm hearing some terrible lung sounds, occasionally they'll order the patient to have some saline. This goes here in this port. I'm going to open up the port. I swab it with alcohol. Now I'm not going to, this is 3 milliliters. I'm not going to put the whole 3 milliliters in there. And see, that's kind of stays in there quite nicely. So I'm going to put probably 1 to 2 milliliters in, and I'm going to leave it. I'm going to let, and as soon as that goes in, the patient is going to start coughing, basically because I'm causing the patient to aspirate. But because it's such a small amount, that what it will do is liquefy some of the secretions. I never put in more than 1 or 2 milliliters. There are some people who will put in like 10 milliliters. I think that's way too much, and I think that will do more harm to the patient than good. So now the patient is coughing. They're loosening up those secretions. So I'm going to go ahead and suction one more time. Take this off. I'm done suctioning, so I'm going to lock this again. If I don't lock this, what's going to happen is that there's a possibility that this could get stuck under their arm and the button will be depressed. So as this oxygen is going in, it'll suck out through here. So make sure that this is locked. And again, these get changed every 3 days for infection control purposes. And please keep in mind that you should be doing oral care every time you suction the patient. They did a huge major study on ventilator-assisted pneumonia and found out that patients who had very good oral care were less likely to get pneumonia, and it increases their likelihood of a good outcome after being on a ventilator. So, I think that's it. I'm going to take off my gloves, wash my hands, and document.